Okay, let's continue with Bloodborne Pathogen Standard, Part 2. The most common and dangerous germs spread through the blood in the hospital are hepatitis B virus, HBV, and hepatitis C virus, HCV. These viruses cause infections and liver damage. HIV, which is human immunodeficiency virus, can also cause AIDS. You can get sick with HBV, HCV, or HIV if you are stuck with a needle or other sharp object that has touched the blood or other body fluids of a person who has one of these infections. These infections can also spread if infected blood or bloody body fluids touch mucous membranes or an open skin, sore, or cut. You have mucous membranes in your eyes, nose, and other moist parts of your body. HIV can also spread from one person to another through fluid in your joints or spinal fluid, and it can spread through semen, fluids in the vagina, breast milk, and amniotic fluid. The avenues of transmission on direct contact, indirect contact, respiratory droplet transmission, and vector-borne transmission. A person can carry and transmit the HIV virus for many years before any symptoms show themselves. According to CDC statistics, HIV-related illness was the sixth leading cause of death among adults between the ages of 25 to 44 years old in 2007. It is still the sixth leading cause of death for this age group today. HIV invades the cells of our immune system and reprograms the cells to become HIV-producing factories. Slowly, the number of immune cells in the body dwindles and AIDS develop. Dormancy is about 7 to 10 years with the ability to infect the whole time. Body makes antibodies but cannot overcome infection. Presence of antibodies confirm the infection. HIV is transmitted by sexual contact, sharing contaminated intravenous needles, breastfeeding, infected mother to fetus during pregnancy or birth, and blood transfusions. HIV is not transmitted by saliva, tears, or sweat, insects, using the same toilet seat, swimming in the same pool, touching, hugging, or shaking hands, eating in the same restaurant, or sitting next to someone. HIV is the virus that gradually weakens the immune system of the infected person, which leaves that person unable to fight off other infections. This leads to acquired immunodeficiency syndrome, also known as AIDS, and it will ultimately cause death. Causes that acquired immunodeficiency syndrome are infection, T4 lymphocytes, HIV injects in the RNA into the host cell DNA to reproduce. Then you have the abnormal function, which leads to cell death, which leads to release of the virus. Clinical manifestations such as acute retroviral syndrome, they may have night sweats, weight loss, fever, and chills. Eventually, if they do end up with AIDS, they have opportunist infections like the pneumocystis carinii and the Kaposi sarcoma kind of like tuberculosis. They'll have clinical manifestations that coincide with those disease processes. HIV infected persons may have no symptoms or may experience symptoms such as swollen lymph nodes, fatigue, weight loss, diarrhea, persistent dry cough, and or fever. Okay, so let's discuss HIV and AIDS transmission a little bit more thoroughly. Healthcare workers are generally considered to have the highest risk of having an occupational exposure to blood or other potentially infectious materials. To date, a total of 57 healthcare workers' exposure resulting in HIV infection have actually been reported to the CDC. The majority of these cases were suspected to be the result of needle stick accidents or exposures through a break in the skin. The body fluid involved in the majority of these cases was human blood. Other transmissions can include transfusions, needle sticks, open skin wounds, mucous membranes, sexual contact, homosexual and heterosexual. Anal sex increases the risk. Direct contact with semen or vaginal secretions. Perinatal, intrauterine, peripartum, and breastfeeding. HIV and AIDS virus dies quickly outside the body. Diluted bleach solutions kill it, the 1/10 solution. Soap and water flushes it off the hands. Medical advances have been made in recent years regarding HIV treatment. There are several antiviral drugs called protease inhibitors that actually have been found to slow the replication of the virus, but it's not a cure. A protocol has actually been developed by the Public Health Service for administering a series of drugs after a high-risk exposure to a known HIV-infected source. The series of drugs is expected to reduce the likelihood that the exposed person will become HIV infected. Hepatitis B virus, also known as HBV, is a virus that causes an infection of the liver which potentially leads to liver disease, liver cancer, and or possibly death. The CDC estimates that between 140 to 320,000 people become infected every year in the United States. You have chronic or acute carriers. There is a 30 to 180 day incubation. There are 200 deaths per year. Hepatitis B virus can survive on environmental surfaces for 7 days. Your high-risk personnel for hepatitis B virus are healthcare workers, blood recipients, dialysis, morticians, people who receive tattoos, parenteral drug users, and unprotected sex. Individuals whose jobs actually involve handling blood and or OPIM are at much greater risk of becoming infected with HBV than HIV. It is because there are many more HBV infected people than HIV infected people in the community. Thus, the chance of exposure to HBV is greater. HBV virus is much more infectious than HIV. According to the CDC, your risk for acquiring hepatitis B infection is 100 times greater than receiving HIV. When considering the risk of occupational exposure to hepatitis B, keep in mind that a safe and effective vaccine is available to you. Symptoms of hepatitis B infection may range from no symptoms to brief flu-like symptoms to jaundice and serious illness. If symptoms do occur, they may not be evident up till 2 to 6 months after the person has actually been infected. However, studies have shown that an infected person can be infectious to others several weeks before the onset of symptoms. Approximately 10% of all the people who become infected may become carriers of hepatitis B. This means that they may suffer from infection at a later time, known as chronic infection. They can also be infectious to others for the rest of their lives while not necessarily demonstrating any symptoms of hepatitis B infection themselves. The transmission and immunization of hepatitis B. Transmission is the same as HIV. Immunization, you will have a series of 3 injections. The first one is given, and then the second one is given 1 month later, and then the third one is 5 months after the second one. Here are a few recommended sites to explore in regards to bloodborne pathogens. This concludes this lesson. If you have any questions that are related to the lesson content, please notify the instructor.